Are home remedies actually safe and effective? There is a lot of talk about home remedies being safe and effective, but is that really the case? There are a few things to consider before choosing a remedy. Is the remedy plant-based or animal-based? Is it something that is commonly used in the region where you live? Is there scientific evidence to support its effectiveness? The safest and most effective remedies are those that have been tested in controlled trials. Despite the fact that many people believe in home remedies, there is little scientific evidence to support the claims of their safety and effectiveness. There are many products sold as home remedies that are not regulated by the Food and Drug Administration, FDA. These products may contain harmful ingredients or may not work at all. Some common home remedies include over-the-counter medications, herbal remedies, and vitamins. Many people believe that these remedies are safe because they have been used for centuries. Now let's see. What are home remedies? A home remedy is a treatment or cure that can be made at home using common ingredients. Many people believe that home remedies are safer and more effective than prescription medication. There are many different types of home remedies, including herbal remedies, aromatherapy, and reflexology. Some people use home remedies to treat minor medical problems, such as a cold or the flu. Others use them to treat more serious conditions, such as cancer or heart disease. While some home remedies are supported by scientific evidence, others have not been proven to be effective. Before using a home remedy, it is important to consult with a doctor to make sure it is safe for you to do so. Some home remedies can cause adverse side effects or interact with other medications you may be taking. Types of home remedies. There are many types of home remedies that people use to treat various illnesses and health conditions. Some people use over-the-counter medications, while others rely on natural or herbal remedies. There are also a number of folk remedies that have been passed down through the generations. Here are some of the most common types of home remedies. Herbal remedies. Herbal remedies are made from plants and herbs. They can be used to treat a variety of health conditions, including headaches, allergies, and insomnia. Natural remedies. Natural remedies include things like vitamin supplements, fish oil capsules, and aloe vera juice. These treatments are derived from natural ingredients and are often considered safer than synthetic treatments. Folk remedies. Folk remedies are traditional treatments that have been passed down through the generations. Many of these treatments involve using common household items, such as vinegar or garlic. Now we know about home remedies and types of home remedies. Now let's evaluate home remedies on 5 important factors, which are efficacy, safety, interactions, side effects, and cost. So, let's start. 1. Efficacy. There are many home remedies that people swear by for a variety of ailments, but how effective are they? In some cases, a home remedy may be just as effective as a prescription medication. For example, garlic has been shown to be an effective treatment for heart disease. Other times, a home remedy may not be as effective as a prescription medication, but it is still worth trying. For example, honey has been shown to be an effective treatment for coughs, but it is not as effective as prescription medications. Home remedies can also be helpful for minor issues like headaches or muscle pain. 2. Safety. There are many home remedies for common illnesses and injuries, but it is important to be aware of their potential dangers before attempting them. For example, although garlic is a natural antibiotic, it can also cause skin irritation. Additionally, cranberry juice is often recommended as a treatment for urinary tract infections, but it can interact with certain medications. It is important to consult a doctor or other healthcare professional before trying any home remedy. 3. Interactions. Interactions between drugs and herbs are a hot topic among healthcare professionals. While some interactions are harmful, many are beneficial. Some people believe that using natural remedies along with conventional medications is the best way to go. Others believe that natural remedies should never be used with prescription medications. What is the truth? The fact is, there is no easy answer. Each person's body reacts differently to different substances. It is important to always consult your healthcare professional before taking any kind of medication, prescription or over-the-counter, or before starting any kind of natural remedy regimen. That being said, there are a few general rules of thumb that can help you avoid harmful interactions between drugs and herbs. First, never mix herbs with prescription medications unless instructed to do so by your healthcare professional. 4. Side effects. There are a few side effects that are commonly associated with home remedies. One is the potential for interactions with other medications. It's important to always check with your doctor before starting any new supplement or remedy, as they may not be safe to take together. Additionally, some remedies can cause stomach upset or other gastrointestinal problems. Be sure to drink plenty of water when taking herbal supplements and start with a small dose to see how your body reacts. Finally, some remedies can have an energizing effect, so if you're looking for a calming bedtime treatment, be sure to choose one that won't keep you up all night. 5. Cost. The cost of prescription medications has been on the rise for years, and shows no sign of stopping. This can be a major burden for people who are already struggling financially. In some cases, it may be possible to find cheaper home remedies that work just as well as traditional medications. One example is treating a cold or the flu. Many people reach for over-the-counter cold and flu medications, but these can be expensive. A much cheaper option is to use natural remedies such as chicken soup, ginger tea, or garlic. These remedies have been used for centuries and are just as effective as over-the-counter medications. Another example is treating pain. Many people rely on prescription painkillers, which can be very expensive. A cheaper option is to use natural painkillers such as turmeric or lavender oil. Now let's see the risks of using home remedies. There are a few risks associated with using home remedies. The first is that you may not be getting the right treatment. Home remedies are often based on folklore and tradition, rather than scientific evidence. This means that they may not be effective, and you may end up taking something that does more harm than good. Another risk is that home remedies may interact with other medications you're taking. For example, if you're taking medication for diabetes and you start taking a home remedy for high blood sugar, the two medications could interact and cause serious problems. Finally, there's always the risk of an allergic reaction to a home remedy. If you're not sure whether or not you're allergic to a particular herb or supplement, it's best to talk to your doctor before trying it. There are benefits of home remedies too. There are many benefits to using home remedies rather than over-the-counter medications or prescriptions. Home remedies are often cheaper, and there is no need to get a prescription from a doctor. Additionally, many home remedies use ingredients that are already in the home, so there is no need to purchase anything extra. Home remedies can also be tailored to fit the specific needs of each person, which is not always possible with over-the-counter medications or prescriptions. Finally, home remedies are often seen as more natural and less intrusive than other forms of medicine, which may make them more appealing to some people. Now let's talk about how to safely use home remedies. There are a number of ways to use home remedies safely. When using any type of remedy, it is important to read the instructions carefully and follow them exactly. If you are not sure how to use a remedy, ask your healthcare provider. Some remedies should not be used if you are pregnant or nursing. When using herbs, it is important to know the parts of the plant that are safe to use and the parts that are poisonous. For example, comfrey leaf is safe to use, but comfrey root can be poisonous. It is also important to make sure that the herbs you are using have been dried and/or ground correctly, as some herbs can be dangerous if swallowed whole. It is also important to be aware of potential interactions between home remedies and prescription medications. When to see a doctor instead of using a home remedy. There are times when it is best to see a doctor rather than try to treat an illness or injury with a home remedy. Here are some guidelines. If you have a fever over 101 degrees, see a doctor. The high fever can be a sign of a serious infection. If you have been vomiting for more than 24 hours, or have diarrhea for more than 48 hours, see a doctor. These conditions can cause dehydration and may require treatment with antibiotics. If you are having chest pain, shortness of breath, or an irregular heartbeat, see a doctor immediately. These symptoms can be signs of a heart attack. If you have severe pain in your abdomen, see a doctor. This could be a sign of appendicitis or another serious illness. Conclusion. In conclusion, home remedies can be safe and effective when used correctly, but it is important to consult a doctor before trying any new remedy. There are many different home remedies that can be used to treat a variety of ailments, so there is sure to be one that will work for you. If you are interested in trying a home remedy, be sure to do your research and talk to your doctor first. Tell us in comment what you think about home remedies. Thanks for watching this video.